Millions of people are opening their phones right now and pouring their deepest personal problems into AI chatbots. Most of them assume no one is watching and no one is regulating the space. But because federal lawmakers have largely stalled out on AI legislation, individual state legislatures are abruptly stepping in to write the rules. To understand how these new laws work, we have to look at this framework. It's an escalation map. It categorizes chatbot interactions into 3 tiers: surface, deep, and crisis. As a user's conversation moves deeper and gets more intimate, the legal intervention gets stricter. States are now dictating the exact operational features, mandatory pathways, and literal countdown timers hard-coded into AI products. We start on the shallowest tier, customer service. California is the primary testing ground. Under Assembly Bill 1609, if a bot cannot resolve an issue, operators must guarantee a human connection within 5 minutes and hold times cap at 10. When a simple service bot steps out of its lane and tries to offer professional guidance, the legal consequences are taking shape in New York. The New York Assembly recently advanced a bill triggered by a lawsuit out of Pennsylvania. In that case, an AI persona provided a state medical license number and offered a user psychiatric advice, even suggesting medication. New York's legislation introduces a private right of action. This means users who suffer actual damages from AI-delivered professional advice can bypass state regulators and sue the operators directly. The legal shield of standard terms of service agreements has its limits. If a bot claims human credentials and inflicts real-world damage, the developer is directly liable for that advice. This brings us up to the middle tier of our map. This is where users form emotional dependencies on therapeutic and companion models. New mandates moving through both California and Colorado force these chatbots to actively block sexually explicit material and self-harm content for users known to be under 18. Colorado is taking an even more aggressive stance on clinical boundaries. House Bill 261195 explicitly bans AI models from generating therapeutic treatment plans or clinical recommendations without the real-time oversight of a human professional. Lawmakers are drawing a firm boundary in the medical field. An AI system is legally permitted to operate as an administrative aid, but it is strictly forbidden from acting as an autonomous doctor. The regulatory pressure peaks at the highest risk tier, what the law requires when an AI detects a user actively experiencing a mental health crisis. Look at this interface change driven by California's Assembly Bill 1988. If a bot detects a credible crisis expression, it must initiate a strict 20-minute crisis interruption pause, effectively freezing the conversation to break the user's cycle of escalation. The industry is already reacting to this standard. OpenAI just globally rolled out a trusted contact feature designed to automatically notify a designated adult when the system detects a severe self-harm scenario. This feature was deployed while OpenAI defends against 3 separate wrongful death lawsuits tied to platform interactions. These crisis intervention protocols have transitioned into mandatory safety standards, built specifically to reduce the liability exposure of the companies operating them. While legislatures write rules, courts administer punishments. Platforms facing the most severe enforcement handle youth data. New Mexico is resting its case in a landmark bench trial against Meta, the first time a state prevailed against a major platform over harm to young people. The state is requesting a $3.7 billion public nuisance abatement plan to fund long-term mental health services for children. Beyond the money, the state is asking for an injunction that would require a fundamental redesign of Meta's recommendation algorithm specifically for minor users. If granted, the injunction would force Meta to fundamentally change how its recommendation systems function for every user within New Mexico's borders. And today, the federal enforcement layer activates to address the spread of AI-generated malicious content. The Federal Trade Commission is now enforcing the Take It Down Act. Through a digital forgery clause, the FTC has jurisdiction over conversational AI products that host or generate explicit imagery. Operators now face a 48-hour internal clock. Upon receiving a valid request, they have exactly 2 days to remove non-consensual intimate imagery and all identical hash-matched copies from their servers. When we map these new rules out, a clear compliance matrix emerges. Developers are now legally bound by a 5-minute customer service cap, a 20-minute crisis pause, and a 48-hour federal takedown window. AI growth is now governed by these precise legal chronologies. Success in the market depends on whether these hard-coded safety mechanisms can withstand the scrutiny of state and federal regulators.